This is not business as usual with regard to IT. These custom algorithms deal with direct bedside clinical decision analysis, as well as administrative and triage issues across the spectrum of healthcare delivery, and as mentioned, created for any facility's specific needs. Applications completed include clinic non-attendance or patients likely to no-show for a visit, chest pain in an emergency department, whether to admit the patient as an observation patient, whether to regular admit the patient, or whether to discharge to clinic follow-up. Clostridium difficile infection and evaluation of clinic patients to reduce the risk of subsequent hospitalization. What is referred to as an IDN determinant study, predicting the acuity level and hence cumulative expenditures of cardiac patients for the following year based on their medication list. Therefore, can estimate the number of primary care provider visits, number of cardiology visits, the need for admission, number of admissions, the need for cardiac cath or subsequent surgery. The physicians at ePhysicians office work side by side with in-house providers. Curricula introduce staff to the true value added of clinical data analytics, improving service, outcome, and cost. Evidence-based measures of statistical significance are built into each completed tool, and this is a key to acceptance by physicians vis-a-vis validity and reliability. A unique feature of ePhysicians Office's functionality is online repetitive automated extraction of a requisite number of datasets from the master database to create another version of the same decision-making algorithm, populated by a fresh set of automated mathematical computations based on those newly extracted datasets. These additional reiterations may be saved. The thresholds and statistical measures of all reiterations may be compared online, that is, apples to apples, to verify the internal validity and reliability of the algorithm. There are numerous levels of service offered by ePhysicians Office. Premier product, which I described, is a completed decision-aiding probabilistic algorithm built and placed online, and facilitation of its inclusion into existing workflows for use by providers with our ongoing involvement. Other services include simply performing an independent analysis of data using our analytics software and offer consultation only. Educational in-service on clinical data analytics can be conducted for all providers and students. Pricing is related to level of interaction, degree and duration of access to on-site functionality, and the number of applications. A few words on getting physicians on board. We know from experience the need to enlist some rock stars from the medical staff, true thought innovators from local leadership. A big data non-medical consultant has stated, quote, "If you're going to succeed in big data, you need a thick skin because you'll get a lot of pushback. You need to define clear roles and responsibility if you're going to do it," end quote. But it's worth it. The advantages and value added are bona fide and measurable.